Hello and welcome to today's discussion on ankle sprains. I'm David Fitzgerald from Dublin Physiotherapy Clinic. Ankle sprains on the face of it can seem like a simple problem, but very often they become non-resolving and slow. I'd like to just share with you some of the details which we as clinicians need to consider when we're dealing with ankle sprains. So this is what you need to know about managing these problems. They're a very common problem, about 25% of all sports injuries. At the severe end of the scale, it can involve ankle fractures, but the ankle is an unusual area in that there can sometimes be subtle hairline fractures of the fibular bone on the outside of the ankle or the metatarsal, which is the outer foot bone, and that often doesn't present very dramatically, so they can get missed. So it's quite important to have a battery of specific tests done to determine if there is a risk of a bony injury there. Achilles tendon injury is another possibility, but usually most astute clinicians will be able to differentiate this very easily, but it obviously needs to be managed quite differently from an ankle sprain. And there are another group of conditions which we look at from a differential diagnosis in just a short space of time. The most common ligament injury in sports is the lateral ligament injury, which is the injury on the outside of the ankle joint. It's about 90% of the time the injury occurs to this lateral ligament complex, and the mechanism of injury is what's described as an inversion mechanism, where the foot twists inward and the body weight goes to the outside of the ankle. Unfortunately, there is a high tendency for recurrence of injuries in this area, and this is one of the big problems with injury prevention, is that very often the initial injury might have been assessed in casualty, x-rays undertaken, and if there's no bony injury, people are given crutches or tubie grip and advised to get going as soon as they can. And often the pain will reduce, but function does not return to normal. And that is one of the biggest predictors of recurrent ankle sprains. And once it becomes habitual, it can be a really difficult problem to rehabilitate and often requires some sort of functional sports brace to prevent it. So, as I've mentioned, the typical injury is an inversion or an ankle roll, where the weight goes to the outside of the ankle and various structures on the outside are tested. So here you can see a typical response to an injury around the ankle ligaments causes some bruising, which can track down into the foot. Sometimes this is slow in appearing. It can be a couple of days, so it can be a little bit alarming if pain levels were fairly modest initially. But it's much better that the bruising and swelling comes out onto the skin than stays compressed within the tissues, because that does slow the rehab time course down considerably. Typically can occur from awkward stepping on uneven ground, missing a step, slipping, or a contact injury. The other type of ankle injury which can occur is an eversion injury, and that's when the foot twists outwards, stressing the joints on the inner side of the ankle and the various soft tissues there. Much less common, but important to recognize, because those tissues are much more stubborn to rehabilitation, and the time course is considerably longer, so it does have to be recognized. Now, you'd be pleased to know I've no intention of going through all the detail of the anatomy here, but it is worthwhile just taking a look here to see at the complexity of the structure. Here we're looking at a right ankle, looking in from the outside. So this is the fifth toe. This is the lateral malleolus of the ankle. So here you can see the tendon structures which run down here, and they're held in place by strong bands of ligamentous tissue called retinaculum. And the tendon itself is covered with a synovial sheath, which can get irritated and cause a tendinitis or a tenosynovitis. So there are specific tests that we can do to differentiate for that. If we take away the tendons and look at the next level below, you can see quite a complex series of ligaments here and here, which help to hold the ankle joint in place. So this ligament complex is part of what forms a scaffolding around the joint. And if we extend down into the foot, we can see that all these joints in the middle of the foot are all held together by varying combinations of ligaments, which can all get sprained as part of a severe ankle sprain mechanism. Again, just looking at the anatomy quite superficially here, we're looking at the inside of the foot, and we see the similar pattern replicated of the tendons running within sheaths, and they help to control the position of the ankle joint. And underneath that we have a complex ligamentous structure which helps to control the alignment of the joints. So it's an intricate mechanism which is vulnerable to various kinds of mechanical strains, and that's a view looking down at the top of the ankle joint. And here the final view is the view from the back of the joint, what's called the posterior view. Here you're looking at the Achilles tendon, and if we look at the anatomy, you can see the Achilles tendon becomes continuous with the calf in the back of the leg, but underneath all of that we have a ligamentous structure here. This is the ligaments, what are called the interosseous ligaments, which join the tibia, the long bone coming down here, and the fibula, and they can sometimes be disrupted when this ankle twists in this direction, as in an inversion mechanism, and that does complicate the recovery process because they have an important role in stabilizing the ankle joint. This ligament here, which you can also see, is called a posterior lateral ligament, and it's a strong cord, not commonly injured in simple ankle injuries, but in more severe ankle sprains, if this ligament is torn, it tends to make it a much more stubborn challenge from a rehabilitation point of view. So that's all the anatomy I wanted to consider. I said we'd come back and look at differential diagnosis, and here are a list of things that we would need to consider. And again, when we're talking about fracture, we're not talking about obvious fracture where the skin is broken or there's a change in alignment and orientation of the leg. As I say, the ankle can sometimes hide subtle hairline fractures or small displacements. So the lateral malleolus, which is the bone on the outside of the ankle, the medial malleolus, and the fifth metatarsal, which is the long piece of bone that connects to the little toe. So they are prone to longitudinal fractures with an inversion type of injury. These other groupings, the talus, which is the bone which forms the ankle joint, and the calcaneus, which is the heel bone, they can also be subject to injury. So a group of clinical tests have been devised to help to try to screen out for those, because they need to be recognised. Another more subtle group of fracture is what's called an avulsion fracture, where there's a small fragment of bone torn away with a ligament or tendon disruption, and it can look just like a ligament strain or a tendon strain. It doesn't look particularly dramatic, but if there is a fragment of bone that's taken away in the disruption of the soft tissue, it does complicate the rehabilitation process, and obviously it requires a longer time scale for recovery. If we look over onto this area on the right hand side, we discussed the option of tendon injuries as being a problem, and they can be anything from an irritation, which is technically known as a tendonitis, or a tenosynovitis if it's the sheath that covers the tendon which is inflamed, ranging then through to partial tears and complete tears, which are more serious kinds of problems. And occasionally you will see dislocation of the tendons. Ankles twisting injuries that cause pain to go up above the ankle into the lower leg, sometimes referred to as high ankle sprains, and they can cause a disruption of the ligaments that join the two long bones in the leg, the tibia and the fibula, and that can be quite a complicating factor too, and often they need immobilization and splinting. The last group to consider here in this discussion are impingements. These are usually overuse kind of problems in sports-related activities, often associated with striking a ball, whether it's Gaelic or football, where there's repeated stress on the front of the ankle, but runners can also get the same kind of problem at the back of the ankle, and sometimes little pieces of tissue and sometimes bony spurs form deep in on the front of the back of the ankle and cause quite a sharp pinch when the ankle is bent in certain positions, and that's important to recognize. And there are groups of conditions that can cause what we would call pseudo impingement, so they look like bony impingement, but they're because of loss of movement in the joints. So important to differentiate those, because one requires surgery and the other one doesn't. So what do we do for treatment? Well, the standard principles for the acute phase for any soft tissue injury, which the mnemonic RICE stands for, rest, ice, compression and elevation for 24 to 72 hours. Non-steroidal anti-inflammatories can also help to speed up the process. Protect from further injury. That is a judgment call whether people need splinting, whether they need to go partial weight bearing on crutches or non-weight bearing. So that is a clinical decision. And obviously the aim is to try to minimize the duration of disability, really. So that's it would be sometimes hard to know whether you should be taking weight on the leg or whether you need to be resting it, but you shouldn't be resting it for very long, more than a few days. Then really it's a case of getting up and getting going. In the subacute phase, the aim is to encourage more movement, work on improving strength around the leg, because that often gets disturbed, making sure that the full mobility of the tissues is restored. And a big focus is what's called proprioception. That's the mechanism of balance and control around the ankle joint, and that's very, very important to rehabilitate, because that's can be one of the big things that leads to recurrent problems. If it's a sports-related problem, then we need to try to replicate the activities that sports involves. And that, again, is a judgment call of knowing how to grade the intensity of loading on the ankle joint. It's not a case of just resting, letting it settle down, and then having a go at doing your sport again. The job of a physiotherapist and any rehabilitation professional is to provide a structured pathway, so there's a series of steps along the way to actually get you back to your desired level of activity, whether it's sport or whether it's hill walking or just simply being able to do normal activities of daily living. In some situations, you need to protect the ankle from recurrent sprains, and one can either use splinting or strapping or use customized ankle braces. Lots of different tools used for rehabilitation. Here's some rubber resistance tubing which can be used to help on strengthening. So that's shown in this diagram here. So that's a way to try and work on these muscle groups along here, the peroneal muscles. This is a towel being used to help to stretch the Achilles tendon. So when the foot's pulled in this direction, these areas here get stretched, and they're precursor exercises to look at something more challenging, which would be a step up off a box or a step or a stair, which is a way of gaining flexibility and also strength in that area. And this is the very well used tool called a wobble board, which is used as one of a number of ways of trying to stimulate balance and control. If one is returning to play the sport, if it's a simple ankle sprain, what's called a grade 1 injury, you can be back in a couple of weeks. If it's a slightly more significant strain with maybe 25 to 30% of the fibers of the ligament damaged, it can be a bit longer, being 2 to 4 weeks. If it's a grade 3, meaning a more significant disruption, it can be anywhere from 4 to 8 weeks, 1 or 2 months. And the high ankle sprains, which I mentioned, which are more complex, they can be 6 to 12 weeks. So they're important to recognize, because they do need specific type of protection if they do occur. So that was a fairly fast trip into the complexities of ankle injuries and some of the factors which we as clinicians need to deal with if we're trying to manage these conditions. If you would like further information, please feel free to contact the clinic, that's Dublin Physiotherapy Clinic, on 8829 174, or our email listed below, info@dublinphysio.ie. I hope this was helpful. Look forward to talking to you again soon. Bye for now.